Welcome, everybody. You're in the home stretch of this course, and so congratulations to you all. You still have some major assignments due, but for the most part, we're on the downhill for this course. I'm grateful for all of your participation in the forums. That always leads to a better class, and I appreciate that. The next several weeks, we're going to be looking at contemporary issues impacting the lives of Native American communities. And we talked about this in our live session, but I think it's really important to address it again because it really frames the way that we should be looking at issues impacting Native American communities. So we're going to revisit some of these major concepts related to historical trauma. So just to review, historical trauma is a collective and cumulative emotional wounding across generations that results from massive cataclysmic events or historically traumatic events. The trauma is held personally and transmitted over generations. So even family members who have not directly experienced the trauma can feel the effects of these events generations later. And new research is really showing that it actually can change the DNA, that DNA is actually changed and patterns within the brain that gets transmitted from generations to generation can actually be documented. Intergenerational transmission of trauma is relatively new, and it really kind of gained momentum, and the foundation of it began in the 1960s by clinicians who were serving children of survivors of the Holocaust and were seeking treatment. The multi-generational aspects of trauma continue to be treated as secondary, and consequently, the behavior of many children of survivors of massive trauma is misunderstood and not treated appropriately, which is why it's important as social workers that we look at these contemporary issues through the lens of trauma and through the lens of historical trauma, because any interventions that we do in Native American communities without integrating that into the treatment modality or without integrating that into the intervention model won't be as effective. So really, we've spent quite a bit of time talking about the boarding school period, so I won't go into it at depth, but that's important because it certainly, especially as social workers, it really identifies not only the historical, very significant historical events that have impacted Native American communities, but it really framed the way and still continues to have impact on the systems that are intervening in the lives of vulnerable children in Native American communities. So, but let's look at that, since we've spent a lot of time talking about the boarding school era and child welfare. Let's look at this at more of the health trauma. So there's been actually a history of medical impropriety in Native American communities. Here are some examples. In 1976, the U.S. government conceded that its Indian Health Service, then a subpart of the BIA, was not in compliance with providing informed consent for sterilization of Native women. So there's a history of forced sterilization of Native women. There was eye surgery experimentations that left Native people blind and damaged. TB hospitals and boarding school Native children received inadequate health intervention. 1982, there were so just as recently as 1982, there were hepatitis B vaccine trials on Native American communities with poor informed consent. In 1976, there were 36 medical experiments with improper consent performed just in the years of 1974 to 1975. And then there's also examples of mental health facilities or insane asylums that were historically served Native people that were not staffed, and that people were left chained and in deplorable conditions. So let's look a little bit at microaggressions and discrimination that continue to impact the lives and that impact contemporary issues related to Native American communities. So some of these are some examples of microaggressions that we might not commonly think of that continue to impact Native American communities and exacerbate trauma. Some say that a misappropriation or appropriation of cultural and spiritual practice in the New Age movement is an example of that. A romanticization and eroticization of American Indian men and women. Another impact is related to this perception of invisibility that oftentimes Native people, especially in areas where maybe there's not as high of a concentration of Native people, are mistaken for different ethnicities, or even assumptions are made about what ethnic background that they are, and then religious defamation. Let's look at discrimination and health outcomes that continue to impact Native American communities. Discrimination has been related to depression symptoms, global measures of distress, anxiety symptoms, and poor general health. Everyday discrimination is much more stressful than time-limited discrimination. So, for people that are part of groups that may experience one-time or isolated acts of discrimination, it doesn't have as strong of an impact on health outcomes as it does when you are experiencing ongoing daily discrimination. Among Native Americans, studies find that perceived discrimination was related to alcohol and other drug use and depression. So again, as we look at alcohol and other drug use, and we look at mental health and depression, it's important to understand that. And evidence suggests that oppressed statuses associated with multiple forms of discrimination may lead to more cumulative physical and mental health symptoms. So again, it's looking at that whole ecosystems perspective that we talk about in social work, and the way that, human beings are part of this interacting whole. And so the way that discrimination can impact not only physical but mental health. Here's just some data on violent assault. So Native Americans are the victims of violent crimes more than 2 times the national average. The rate for Native women was 2.5 times the rate for all females, and nearly double that of African American females. American Indians are twice as likely to experience a rape, sexual assault compared to all other races, and they're more likely to experience interracial violence. So 60% of the assailants are white. And we talked about that a little bit, and maybe some of the reasons for that in our live session. Let's look at the effects of traumatic stressors on health outcome. Historical and contemporary traumatic events can lead to something that in the literature is often referred to as the soul wound. The soul wound or spirit wounding is the cumulative effect of historical trauma brought on by centuries of colonialism, genocide, and oppression. This can be looked at in the research of Duran Duran. Psychological ramifications include internalization of the oppressor, unresolved grief and mourning, and suicidality. I think we often will see this in the mental health field in Native American communities, this internalization of oppression and the internalized beliefs about self and community is often something that mental health professionals have to work through with the people that they're serving. Diagnostic categories of PTSD often fail to capture the complete and utter wounding of the spirit that is caused by such traumas. So our current day diagnostic criteria for PTSD really looks at events that have occurred in the recent past in people's lives, or in the past of people's life, but doesn't look at it from the historical trauma that gets passed down to generations. Let's revisit this triangle of risk just to get that idea that all of these things are part of an interacting whole, and so that the trauma and violence that people experience then impacts their use of alcohol, drugs, and also impacts mental health, which impacts other health risks and behaviors, which then again leads to the cyclical cycle. So let's look at this model of trauma, coping, and health outcomes. So you have the trauma, historical trauma, microaggressions, all these things that I was just talking about. But then we can look at coping. And I think that's what's really important to look at is that the interventions, and we'll be really looking more in depth at this as we move into the next couple of weeks and we look at these contemporary issues and what's happening, but we'll also be looking at solutions, and certainly in especially the books that you're have assigned reading, we'll definitely be visiting that and talking about that. So that's important as we talk about these serious issues that are impacting Native American communities. It's also important for us to look at what things mitigate that and what are solutions and protective factors around that. So certainly cultural buffers, identity and attitudes about identity, enculturation, connecting back to culture, connecting back to traditional health practices, and spiritual ways of coping are ways to mitigate that. So I hope this very brief lecture was helpful to you in integrating your knowledge of historical trauma and the impact of that on relevant issues. As always, please feel free to contact me if you have any questions or concerns. I will be out of cell phone range on Wednesday and Thursday and part of Friday. So I apologize for that, but I will get back to you as soon as I can. And I hope you all are having a wonderful week.